Dallas-Fort Worth Stockyards, a great place to watch a real deal cattle drive, but we didn't make it very far before our Metroplex friends stopped us with some health questions.
And we'd like to welcome you today to the historic Fort Worth Stockyards. Since 1999, we have been driving beautiful Texas Longhorn steers along East Exchange Avenue every day to commemorate a time in history when Texas Longhorns were brought right through this area along the Chisholm Trail.
It's a good thing none of us are wearing red.
I got the whole red going on.
They used to drive the cattle up to Kansas and then after the gold rush to California. That's a long haul.
Their horns are huge.
Yeah, they are.
Come on, let's get it on, little doggies.
I think Drew is playing his role a little too seriously. He actually thinks he's a cowboy. I'm about to break his cover.
Let's get it on, little doggies.
Plastic surgeon. All right, so we're in Fort Worth. Let's walk around and meet some folks.
Yeah.
Is it safe riding a horse with a toothpick?
I've been doing it for a while.
I know, I can tell. You look quite comfortable.
Every day working here, we deal with a lot of hay and dust, and how would you cope with the allergies it creates?
You can obviously take medicines to counteract the histamines that are released when you're exposed to that stuff. But the other thing that I would do, I would actually wear, when you're around the hay and the dust, I would wear a mask. You know, what I always say to people, the best way to treat allergies is to avoid them.
So Dr. Lisa, my cousins just got tested to see if they had the gene for breast cancer. I'm wondering if I should be getting tested for this gene.
What you're talking about is the BRCA gene, the BRCA1 and 2 genes. And if you have a family history, this is the question now. Do you get tested to see if you have that gene? Because even if you don't have the gene, you still have a risk of getting breast cancer, and that's what you have to know.
Okay.
It's really up to you. You kind of have to think about, well, if you test positive, are you going to take medications, or are you just going to do your routine screening and keep up with that and talk to your doctor?
Thank you so much.
You're welcome.
I frequently get styes around my eyes, so I was wondering what could be the reason and how do I prevent them?
We have little glands that secrete oil to lubricate the edge of our eyelids and the eyes. And just like when you get a pimple, if those glands get clogged, you form a stye. So do you wear much eye makeup?
I wear contacts.
Couple things. Be real careful putting your contacts on. Make sure your hands are really clean, and make sure you take off all your makeup at night, and I bet you that'll help the problem.
My 15-year-old son has not had chickenpox yet. Do I need to get him vaccinated?
We don't want them catching chickenpox as an adult. So always recommend if they become a teenager and they haven't had the shot yet, it's important to get it.
All right, so Patron, I think they said you had a question for me.
Howdy, Dr. Lisa. How come when I'm in the pasture with the other cows, there's this one little lady that I find so much more attractive than the rest?
That's all about hormones. Hormones and chemistry. There's a certain chemistry that you react to, and pheromones. Everybody has their own special pheromones, so that's why you find that one special cow prettier than that other cow.
Why, thank you, Dr. Lisa. Now, hop on up.
I'm on a bull, people. Woo-hoo. Cowgirl in me is coming out.
Honey, I'm bringing home a new pet. I hope that's okay. This pet will work great in LA, huh?
Hey guys, wait up! Come on, giddy up! Come on! Yeah!